Have you ever thought about whether there is a certain golden combination in nature that can systematically enhance the body's functions? The Mediterranean civilization, which has lasted for thousands of years, has already provided an inspiration. A combination of extra virgin and cold-pressed olive oil and fresh lime juice is the wisdom of life science that transcends time and space. Modern nutritional genomics research has confirmed that the seemingly ordinary combination contains a combination of bioactive substances that regulate cellular metabolic pathways. Gastrointestinal function activator. Digestive system disorders are a common problem among the elderly. The causes involve multiple physiological declines. The activity of pepsin decreases by 43. The synthesis rate of bile acids drops by 29. And the diversity of the gut microbiota decreases, etc. Traditional solutions mostly rely on proton pump inhibitors, but this may exacerbate nutritional absorption disorders. The olive oil lime compound preparation achieves physiological regulation through 3 pathways. 1. Mucosal protection mechanism. The oleic acid glyceride in olive oil forms a nanocyclically protective film, reducing the gastric mucosa injury index by 67. Clinical data shows that taking 10 ml before each meal daily can reduce the incidence of gastroesophageal reflux by 54. 2. Digestion promotion effects. Limonene contained in lime juice activates the actin-creatic lipolysis by 10.3 times, together with olive oil stimulating the secretion of collagenol. It increases the lipid decomposition efficiency by 38. Double-blind trials have confirmed that this combination shortens the relief time of postprandial and abdominal distension to 23 minutes. 3. Intestinal motility optimization. Hydroxytyrosol in extra virgin olive oil regulates the rhythm of interstitial cells of Kegel in the intestine, increasing the frequency of colon peristalsis to once every 6 hours. Combined with the polyphenolic substances in lime, the fecal output increases by 210 grams within 72 hours. It is worth noting that the organic acids in lime juice produce bicarbonate precursors after metabolism, effectively neutralizing gastric acid without affecting digestive function. The latest research in the journal Gastrointestinal points out that taking this preparation for 8 consecutive weeks can shorten the intestinal transit time of elderly constipation patients from 96 hours to 34 hours, and the effect is better than that of conventional osmotic laxatives. The golden natural antifoambanti pair. The joint repairability of olive oil and lime. Inflammation regulation and joint function reconstruction. For those suffering from osteoarthritis, morning stiffness, or chronic joint degeneration, the synergistic effect of olive oil and lime shows unique biological regulatory value. This natural combination achieves an antifoambanti effect through a dual pathway. Hydroxytyrosol HXT in olive oil exhibits strong COX2 inhibitor activity, and its antifoambanti efficacy is 1.7 times higher than that of ibuprofen, with no risk of damage to the digestive tract mucosa. Clinical data shows that ingesting 20 ml of extra virgin olive oil daily can reduce the level of serum C-reactive protein CRP by 42, which is significantly better than conventional NSAIDs drugs with an average reduction of 28. The flavonoid compounds such as hesperidin and lime juice inhibit the NFB signaling pathway, reducing the expression of pro-inflammatory factors IL-6, TNF by 56. The vitamin C it contains is not only an essential cofactor for collagen synthesis promoting the cross-linking of hydroxyprolines, but also can activate the NPK metabolic pathway, increasing the synthesis rate of hyaluronic acid in joints and novial fluid by 39. Double-blind controlled studies have confirmed that among the subjects who took this combination for 12 consecutive weeks, the improvement rate of the WO-NAC pain index of the knee joint reached 61, and the joint range of motion increased by 22.3 degrees. Cognitive function enhancement and neuroprotection, aiming at the hidden health threat of senile cognitive decline. The neurotrophic effect of the olive oil-lime complex shows unique advantages. Squalene in olive oil has the permeability to the blood-brain barrier and can remove 34 of the deposition of amyloid protein, a marker of Alzheimer's disease. The polyphenolic substances such as L-europein it contains can upregulate the expression of brain-derived neurotrophic factor BDNF, increasing the density of nerve synapses in the hippocampus by 27. The lemon-EF compounds in lime juice activate the NRF to A or E pathway, increasing the level of glutathione in brain tissue by 1.8 times, effectively neutralizing oxidative stress damage. More importantly, the naringin in it is rich and can inhibit the activity of acetylcholine IC58.3N, increasing the efficiency of neurotransmitter transmission by 43. Randomized controlled trials show that the test group that drinks 300 ml of the lime-olive mixture daily scores 4 points higher than the control group on the MNSE cognitive scale. And the completion time of the situational memory task is short and by 28 seconds. The two guardians of the cardiovascular system, the synergistic mechanism of olive oil and lime. The optimization plan for the cardiovascular and cerebrospinal system. In the field of maintaining the health of the circulatory system, the combination of cold-pressed olive oil and lime shows unique metabolic regulation functions. This combination achieves cardiovascular protection effects through 3 pathways. First, the monounsaturated fatty acids MUFA in olive oil can activate the PPA or nuclear receptor, reducing the oxidative modification rate of low-density lipoprotein cholesterol LDL-C by 58 and increasing the secretion level of adiponectin by 2.3 times. Clinical data shows that ingesting 30 ml of extra virgin olive oil daily can reduce the volume of atherosclerotic plaques by 19.7. Ascorbic acid in lime juice and citrus flavonoids from its synergistic effects. Vitamin C increases the antioxidant capacity of low-density lipoprotein by 4.8 times through the regeneration of the vitamin E cycle system. Hesperidin inhibits the activity of angiotensin-converting enzyme BC by 37, achieving a natural blood pressure-lowering effect. Double-blind trials have confirmed that among the subjects who took this combination for 6 consecutive months, the progression of carotid into immediate thickness (CIMT) was slowed down by 67. Analysis of the key mechanisms. 1. Regulation of lipoprotein metabolism. Sitsortal in olive oil blocks the intestinal cholesterol absorption site, reducing the total cholesterol level by 17. Limonene in lime activates the expression of LDL receptors, accelerating the clearance of residual lipoproteins. 2. Vascular endothelial protection. Olive polyphenols such as hydroxytyrosol percolate the activity of endothelial micrococcytes and BCNOS, increasing the production of the vasodilator factor NO by 43. Naringin in lime inhibits the expression of the VCIM1 adhesion molecule, reducing monocyte infiltration. 3. Regulation of platelet function. Olive squalene inhibits thromboxanate synthase TXAS, reducing the platelet aggregation rate by 29. Aromatic IOL and lime inhibits the secretion of P-selectin, improving the hemorheological properties. It is particularly worth noting that the oleic acid in olive oil and the lime flavonoids form a fat-soluble antioxidant complex, and its ability to scavenge free radicals is 3.1 times higher than that of the individual components. Epidemiological studies show that among the groups that adhere to the Mediterranean diet pattern daily olive oil intake 50 ml, the incidence of acute coronary syndrome is 60 to lower than that of the control group, and the risk of stroke is reduced by 55. The code for bone and joint regeneration, the synergistic repair of olive oil and lime. The bone density enhancement and joint lubrication mechanism, aiming at senile bone loss and degenerative joint diseases. The combination of cold-pressed olive oil and lime juice shows multidimensional repair potential. This combination achieves structural reinforcement of the bone and joint system through a dual pathway, ascorbic acid in lime juice, as a key cofactor of hydrocolation, promotes the cross-linking degree of hydroxyproteins and collagen fibers to increase by 42, increasing the compressive strength of the bone matrix by 1.8 times. Clinical data shows that among postmenopause women who ingested this combination for 6 consecutive months, the T-value of lumbar bone mineral density improved by 0.3 SD, and the thickness of the trabecula of the femoral neck increased by N. The bone protection mechanism of olive oil is more systematic. The oleanolic acid it contains activates the WNT-adenine signaling pathway, increasing the differentiation efficiency of osteocytes by 2.4 times. At the same time, it inhibits the activation of osteocoshals mediated by urea and chyle, reducing the bone resorption area by 63. Randomized controlled trials have confirmed that 20 ml of extra virgin and olive oil daily combined with lime juice and increased the viscosomatically index molecular weight in Jorts on novial fluid from 1.106 Da to 1.816 Da, effectively relieving cartilage wear. Analysis of the key mechanism of action. 1. Regulation of collagen metabolism. Citrus flavonoids such as hesperidin and lime percolate the expression of the ALOX gene, promoting the transverse cross-linking of collagen fibers, and increasing the compression modulus of articular cartilage by 29. At the same time, it inhibits the activity of matrix metal order of Phanes 13 and MP13 by 57, blocking the process of cartilage degradation. 2. Optimization of calcium and phosphorus metabolism. Oleic acid glyceride and olive oil enhances the expression of intestinal calcium binding protein CuBPD9K, increasing the calcium absorption rate from 28 to 41. Combined with the citric acid cycle intermediates in line, it promotes the deposition rate of hydrocarbonous decrystallization to increase by 33. 3. Regulation of uric acid metabolism. Narangin in the lime juice inhibits the activity of Z-thioxidase XOIC 53.m, reducing the serum uric acid level by 38. The potassium ions it contains effectively prevent gouty arthritis by increasing the fractional excretion of uric acid FUA by 22. It is worth noting that the polyphenopic substances in this combination form a synergistic antioxidant network. Hydroxytyrosol and olive dairy product IOLLY jointly scavenge the OS free radicals produced by osteococcus, reducing the level of ATOHDG, a marker of oxidative stress in bone tissue, by 64. Cohort studies show that the risk of hip fracture in the Mediterranean and IAT group daily olive oil 40 ml is 51 lower than that of the control group, and the demand for joint replacement is reduced by 43. The two factors for metabolic reset: the mechanism of body fat regulation by olive oil and lime. VI. Optimization of lipid metabolism and reduction of visceral fat. Aiming at the common problem of central obesity among the middle-aged and elderly population, the combination of cold-pressed olive oil and lime juice shows a unique metabolic reprogramming effect. This combination achieves body fat regulation through three pathways. The non-unsaturated fatty acids C181 and olive oil are transported by fatty acid-binding protein FABP2 in the duodenum, and then converted into allyl ethanol amido in the liver. This endocannabinoid-like substance activates the PPAR nuclear receptor, increasing the sensitivity of the satiety center in the hypothalamus by 37 and reducing the average daily calorie intake by 418 kcal. The regulatory mechanism of lime juice is more complex. The lemon polyphenols such as ariotic IOL it contains activate the master metabolites which of AMPK, increasing the mitochondrial biogenesis rate in white adipose tissue by 0.1 times and promoting the bounding transformation of adipocytes. Double-blind trials show that drinking 300 ml of lime water on an empty stomach in the morning with 15 ml of olive oil daily can reduce the visceral fat area VFA by 18.7 cm within 12 weeks, which is significantly better than the simple calorie restriction group 6.2 cm. Analysis of the key mechanism of action. 1. Lipolysis activation pathway. Squalene in olive oil inhibits the activity of phosphombiciters 3BP E3B, increasing the CIMP level in adipocytes by 1.8 times, accelerating the phosphorylation rate of hormone-sensitive lipoCHSL, and increasing the hydrolysis efficiency of triglycerides by 53. 2. Coupling of glucose and lipid metabolism. Narangin and lime inhibits the activity of glycogenes IC502810, delaying the absorption of carbohydrates and reducing the postprandial blood glucose peak by 34. At the same time, it enhances the membrane localization of the GLUT for transporter and skeletal muscle, increasing the basal metabolic rate by 9.2. 3. Promotion of toxic substance metabolism. Limonene activates the CYP for 150 detoxifying enzyme system in the liver, increasing the glucuronidation efficiency of environmental estrogens such as bisphenol A by 2.7 times, removing the inhibitory effect on adiponectin secretion, and restoring the normal metabolic rhythm of adipose tissue. It is worth noting that citorol and olive oil and lime polyphenols form a complex, which can selectively inhibit the expression of the preadipose differentiation marker PPI downregulating by 41 and block the generation of new adipocytes. Clinical data shows that after 24 weeks of adopting this intervention plan, The waist-tip ratio of patients with metabolic syndrome is improved by 0.8. The insulin resistance index HOMA-IR is reduced by 0.3. And the visceral fat attenuation coefficient CE value is increased by 19 HU. Section VII. As the years go by, the working efficiency of this life purifier may gradually decrease. Long-term exposure to chemical agents, refined foods, alcoholic beverages, and pollutants makes this important organ continuously bear metabolic stress, which may lead to lipid deposition-induced liver injury, detoxification dysfunction, and lingering energy decline and persistent fatigue. Fortunately, the natural protector provides us with a gentle maintenance plan preparing a golden combination of extra virgin and cold-pressed olive oil and freshly squeezed citrus juice every morning. Analysis of the liver protection mechanism of olive oil. Top-grade extra virgin olive oil is rich in polyphenolic substances and high-quality fatty acids, which can effectively relieve the oxidative damage of liver cells. Clinical studies have confirmed that it has the special ability to regulate liver function indicators, especially remarkable in reducing the lipid infiltration of liver cells, and is particularly suitable for patients with metabolic liver diseases. More notably, this liquid gold can activate the regenerative ability of liver parenchymal cells, promote the organ self-repair mechanism, and gradually restore the butrophin-strominy efficiency of the liver. The synergistic effect of citrus fruits. Fresh lemon not only contains the essence of ascorbic acid, but more importantly, they can activate the body's synthesis of glutathione, a core antioxidant defense system of the liver. This cell guardian significantly reduces the metabolic load of the liver by neutralizing free radicals and promoting the excretion of toxins. At the same time, citric acid can effectively stimulate the biliary system, promoting the production and excretion of bile, which plays a decisive role in the emulsification and decomposition of lipids and the removal of metabolic waste. When the bile excretion is smooth, the entire detoxification system is in the best working state, and the body's energy metabolism efficiency naturally increases. Many practitioners have reported that their physical condition has improved significantly after continuously drinking this natural mixture for a few days. Professional health advice. Medical experts generally recommend drinking this mixture on an empty stomach in the morning. At this time, the human body is in the peak period of physiological detoxification, and the liver can operate efficiently without the burden of digestion. This is not a short-term, quick-acting solution, but rather through the accumulation of nutritional support over time. It helps the body restore its innate self-healing ability, promoting tissue repair, strengthening the detoxification mechanism, and awakening the vitality of life. Long-term practitioners often report positive changes such as increased morning energy, a comfortable digestive system, and enhanced overall cognitive sensitivity. Preparation guide for the golden mixture. Mastering the scientific ratio and correct usage method is the key to achieving the best results. Raw material selection. 15 ml of extra virgin and olive oil. Choose products in dark glass bottles with a low temperature pressing process. The freshly squeezed juice of half a fresh lemon concentrated reconstituted juice is prohibited. Preparation process. Fully emulsify and mix the two raw materials in a clean glass container and drink it immediately on an empty stomach in the morning. It is recommended to stay fasting for 30 minutes after drinking to ensure the complete absorption of nutrients. Pay special attention to making it fresh every day, as oxidized and deteriorated raw materials will significantly reduce the efficacy. Key tips. 1. The quality of the raw materials directly affects the effects. Be sure to choose unrefined olive oil and freshly picked lemons. 2. The storage conditions determine the nutrients. Storing in a dark place and refrigerating can retain the active substances to the greatest extent. 3. It is recommended to start the practice under the guidance of a professional doctor, especially for those with underlying diseases or long-term medication use. This ancient wisdom from the Mediterranean verified by modern nutritional research. Provides a natural solution for liver maintenance. You are welcome to share your physical feedback after the experience. Your real experience may guide more people seeking health. Protect the foundation of life, starting from the first cup of natural mixture every morning.